I chose speech pathology as a postgraduate course at the University of Queensland after I completed a degree in psychology. I really liked the combination of therapy but also the application of science, which is the foundation of speech pathology. I really liked pursuing it as a career, mainly because you actually have the capacity to affect change. As an academic and a researcher and a clinician, so that involves teaching, research and clinical work. So with Huntington's disease, people know they're going to develop because they have the genetic marker. Those who present with this genetic marker actually present with some really subtle changes in their speech before they develop all of their other symptoms, which means that we can actually provide some very useful information to the medics working within the team that the disease is actually progressing and that treatment can ensue earlier than what they previously thought possible.